Hello, welcome to my YouTube channel. So first of all, today we are going to learn why we prone the patient with the COVID. For that, we have to go into the physiology, and in physiology, first of all, we will see that in supine position, when the patient is lying on his back and his face is facing upwards, we will see that it has getting pressure from two things. First of all, above by the heart, this is the heart and these are the lungs. You can see in the picture. So these are the lungs that are getting pressure from upwards by the heart, and from the lower part, as you can see this, there are actually the viscera and the intestine and the stomach and the liver, which is pressing outwards through the diaphragm. So both these pressure in the supine position causes the posterior alveoli. These are the posterior, as you can see that this is the posterior portion, this is the interior portion, and similarly in the CT this is the cross section. So the interior, as I mentioned, this is the interior and this is the posterior parts are of the alveoli are collapsed, because on anterior surface we got the pressure from the heart, and from the lower part we are getting the pressure from the diaphragm with the viscera pressing outwards. So all these condition causes the posterior this causes the posterior alveoli to collapse. So when the posterior alveoli are collapsed, there is no proper ventilation going on. First of all, the drawback is there is no posterior alveoli ventilation, and second problem is that when we ventilate the patient with COVID, at that time there is a risk of barotrauma. Why? Because as we can see that the posterior alveoli are collapsed, so the air that is if we intubate this patient, so that air is going only into the interior. This is the interior, so all the air going to the interior, these are the interior part of the lungs. So that causes the barotrauma, that causes the hyperventilation of the interior alveoli. So when the anterior alveoli are hyperventilated, they cause the barotrauma, and if we cause the barotrauma, that can cause the damage to the lungs. So in this we will see that in prone position how it is very much feasible. When the patient is lying in prone position, the prone position means the face is facing downwards. So in this condition, as you can see that the abdominal viscera are pressing downwards. There is no effect toward the lungs, as according to the gravity they press downwards, and similarly the heart is also facing downwards and there is no pressure on the lungs. So due to this condition, the posterior alveoli that are normally collapsed in supine position get inflated. So in this we can prevent the hyperventilation during the patient on ventilator, and similarly we can decrease the ventilation perfusion mismatch. So we can also go into the physiology. What is VQ? V is the ventilation and Q is the perfusion. So how we can prevent the VQ mismatch? We can prevent the VQ mismatch by two things. That normally in the patient the perfusion is okay, the problem is the ventilation. So when the posterior alveoli got inflated, the VQ mismatch is also decreased.